Hi, I'm Dr. Jacquie Halladay on behalf of the COMPASS team and our team's primary care providers who have helped create the content of this presentation. I'm going to take you through a brief journey of the COMPASS project so that you understand the steps your patients will go through from their hospital stay to their office visits with you for ongoing care. To demonstrate the main aspects of this study in this video, I'm sharing the experiences of how this work is being performed at Wake Forest Baptist Medical Center, which serves as a testing ground for the COMPASS study. Be assured that we fully grasp that the COMPASS program will likely be implemented differently from what is presented here as it's rolled out in the different health systems across North Carolina. But as a pragmatic trial, that is expected and welcomed. We anchor this work on 4 key messages that drive the activities of those who engage in the COMPASS trial, be they patients, caregivers, primary care providers, pharmacists, home health therapists, or others. Using a pragmatic approach, although we focus on these 4 messages, we are not overly prescriptive as to how to deliver this care in any one setting, but hope that you will join us in working with patients to find their way forward by knowing their numbers, specifically to track their blood pressures over time and to work to reduce their risk of recurrent stroke by keeping their blood pressures under control, along with their lipid levels and other risk factors. To be physically active, regain strength and balance, and to engage in activities that keep their mind and body optimally moving towards recovery and living life to its fullest. Understand and use community resources and supports that can guide recovery. And be willing to manage and adhere to recommended medications, treatment plans, and lifestyle behaviors to optimize outcomes. Before we dive into the patient experience, I want to make sure that you are informed that half of the involved health systems in the study will not be exposed to the COMPASS study intervention initially. This design allows us to compare the results among patients and caregivers who are exposed to the COMPASS intervention versus those receiving usual care. In general, you can assume that if your patient has any of the COMPASS study materials, like the blood pressure log or eCare plan that I will show you later, that they are in the intervention arm, not the usual care or control arm of the study. However, since half of the hospitals involved in the study across North Carolina are in the control arm, it is possible that in rare circumstances you may see patients from both study arms, which can be tricky, as this can introduce what's called contamination in the research context. That could occur if all of a sudden patients in the usual care arm were being provided with resources that they would not have been otherwise. This is nothing to be overly worried about, especially in a pragmatic trial, but I wanted to at least highlight this possibility. As indicated in this slide in the orange and blue boxes, outcomes will be assessed at 3 months post-discharge, and administrative claims data will be used to track other outcomes out to 1 year. And in the future, the control health system sites will be provided the COMPASS materials. So on to the patient view. Patients are initially met in the inpatient units by a post-acute care coordinator, who I will call a PAC or a PAC going forward. The PAC in this picture is the woman in the multicolored shirt holding an iPad. The PAC will meet a patient near the time of hospital discharge, enter some basic patient demographic information into the iPad, provide patients with COMPASS materials like refrigerator magnets and the very popular home blood pressure monitoring log pictured here in the middle top photo. The PAC then communicates with the patient during a phone call that will occur approximately 2 days after hospital discharge. This is a brief but important check-in to make sure that the patient has an appointment with their primary care provider, that they understand the signs and symptoms of stroke, that appropriate referrals have been made to community-based services, and that transportation needs are addressed. At the 7 to 14-day visit, the PAC will see the patient again as part of a structured visit with an advanced practice provider, or APP, who at Wake Forest are nurse practitioners, but I will use the term APP for the rest of this video. The key COMPASS messages drive this appointment. Thus, adherence and risk factor monitoring are addressed, along with making sure that the patients are working to regain their strength and balance to optimize their physical functioning. The PAC performs a functional assessment, which is completed by asking the patient a variety of questions, and the questions are entered into the iPad. All of this information feeds into summary documents for the primary care providers and others. Caregivers that accompany the patient to this visit are also asked questions about their own competing priorities, their ability to provide help, and they are linked with caregiver-specific resources. This slide lists some further types of issues addressed by the PAC at this visit, and those addressed by the APP, including identifying deficits or needs that may have been missed during the hospitalization. Here the APP is writing directly on a medication bottle that the pills are for blood pressure control. She helps the patient understand how to use a pill organizer and checks to make sure the patient knows how to accurately use a home blood pressure monitor and how to document the blood pressures in a log for review with you at office visits. This slide summarizes the main messages and the main items addressed at the 7 to 14-day visits, which are key elements of effective chronic care management more broadly. Of note, in some cases, the APPs may be ordering cardiac monitoring or other tests at this 7 to 14-day visit that need to be followed up on. Importantly, recovery is discussed, and it is emphasized that recovery can be long but progressively positive journey. Ultimately, all relevant information will be included in an electronically created care plan, which we call the eCare plan. The APP will provide the patient with a hard copy of the eCare plan and will encourage the patient to bring their eCare plan to their primary care appointments and appointments with other providers. The patient is referred to relevant regional resources, including those provided by the Area Agency on Aging, local pharmacies, home health care, and faith communities. Next, we pivot to the provider view of COMPASS, thus how you can engage in the key messaging and care with patients, and in the COMPASS study itself. Quite intentionally, we share the 4 key messages again in this video, as we hope you will continue to work with patients in these domains. As a brief overview of primary care provider involvement, ideally and over the course of time, we hope that PCPs will continue to coordinate risk reduction strategies for patients and reinforce the key messages to engage mind and body for recovery, optimize secondary prevention, and connect with community resources. This slide should look familiar, but it specifically highlights how PCPs will be provided access to the information generated by the COMPASS team. The eCare plan can be a lengthy document depending on the patient's needs. It is given to patients as a hard copy, but it's also going to be available to providers on a secure web platform. The hope is that patients bring their hard copies of their eCare plans to their PCP visits, such that when ready, the patients can work with their providers to address care goals. Key clinical information will be faxed to you via the COMPASS provider cover letter and the APP clinic note shown here at the bottom right of the screen. The COMPASS study cover letter will include key information about the index hospitalization, type of stroke, recommendations for treatment and secondary prevention, and the COMPASS study contact information. This will also include a trifold COMPASS study brochure that includes the 4 key messages and a formulary with preferred medications highlighted and some general information about medication costs. The APP clinic note includes latest lab test results, blood pressures, information about outstanding evaluations such as imaging and monitoring studies. Next, we present very general care goals and thresholds from the 93-page guideline document published in 2014 in Stroke by Kernan et al. This is a great resource for understanding the evidence for treatment recommendations for specific patients. But for this video overview, we are keeping this on a very high level Of course, recommendations for your unique patients will need to be carefully considered by you and your regional consultants. In general, 140 on 90 is the blood pressure target. We are strongly encouraging patients to take blood pressures with validated home devices and to write down their measurements in the blood pressure log. The log includes a link to a very brief and publicly accessible video on how to take accurate home blood pressure measurements. Additionally, it's critical to make sure that the patient is on the right regimen of anticoagulants and/or antiplatelet agents, and to make sure, in cases where patients may have been on aspirin prior to their stroke, that it is clearly communicated if they should remain on aspirin, and if so, at what dose. For those with atrial fibrillation and on warfarin, recommended INRs are between 2 and 3, and higher for those with mechanical heart valves. But again, work with your local referral resources to make sure that your unique patient is on the right anticoagulation regimen. A key recommendation is to have patients who have had a stroke on high-intensity statins, regardless of their lipid levels. And again, the COMPASS formulary includes dosing and cost information for these essential medications. Here's how the COMPASS formulary looks. Upon closer review, you will be able to see what our consulting neurologists and pharmacy professionals consider as the preferred choices. It has been recently updated to include direct oral anticoagulants, which are becoming more widely available and at more reasonable costs. This slide provides the dosing information for those 75 years old and younger versus those over 75. And here the less expensive regimens are in bold text. This next slide shows you the eCare plan, thus what the patients may bring in with them to their visits with you. My goal here is just to demonstrate that it is organized by the 4 key messages, provides recent lab values or blood pressures, and includes suggestions as to actions patients can take towards recovery. The first one here focused on numbers, and the subsequent ones on how to engage in their care, be willing to optimize their health and adherence to treatment recommendations, and to connect with supportive resources. The summary view in the eCare plan drives home the 4 messages: to maximally manage their risks, stay physically active, ask for support, and be willing to adhere to critically important medications. So as a quick recap and what to expect next, the COMPASS method of chronic disease care management for stroke survivors aims to identify and quickly remedy care gaps, provide timely follow-up and links with community resources, and strives to keep patients living meaningful and active lives. The COMPASS team will be an additional voice in helping to address the new realities of going home, possibly with new deficits and new roles for caregivers. And once we identify a PCP with a patient in the trial, we can email concise monthly information to you that you can use with your staff and patients regarding enhanced stroke care. These include information about methods to use to communicate with stroke survivors, the evidence that describes optimal methods for physical therapy interventions, how to manage depression and anxiety in these patients, information on insurance coverage for therapies, and other key information. As a PCP of a COMPASS patient, you can have access to the COMPASS materials and eCare plans. You will need to complete a simple registration process, which is available at this web address. Please know that your local PAC or PAC is a great resource for any questions you may have, and there is plenty of contact information on our website, which is listed here. Be mindful to put NC in front of COMPASS and to use the hyphen as noticed. Lastly, in our formative work, we heard from PCPs that they would like a specific update on the evidence base for physical therapy and movement recommendations. Thus, we are looking into having another video for PCPs specifically to update you on this important aspect of patient care, Let's keep a lookout for this opportunity.